teaching second grade and particularly teaching elementary school really taught me how even little changes early in life can make a huge compounding effect later in life in terms of the trajectory of a kid's life. And so I think there's a lot of corollaries to pediatric cardiology and just pediatrics in general. Hi, my name's Teddy Jones, and I'm a genetic cardiologist at Lurie Children's Hospital. Cardiology, to me, you get to wear a lot of hats. You get to work with some of the sickest kids in the hospital in the intensive care unit. You get to work with families as an outpatient and really get to know them over time and build an alliance with them over time. And then you get to be your own radiologist and read echoes and CTs and MRIs. I specialize in cardiovascular genetics. So cardiovascular genetics is sort of the intersection between cardiology and your DNA. And it's sort of a new field in that we're learning so much more about how genetics plays a role, not just in how we diagnose disease, but also how we prognosticate, how we risk stratify, and ultimately it's also making its way into how we manage and treat disease. And so to me, cardiovascular genetics is sort of the new frontier in terms of how we take these things that we're learning about and apply them on a precision basis to individualized care. So I focus my research interests in sort of two categories, one being the genetics of congenital heart disease. I think the other area of really big interest to me is physical activity and exercise in those with genetic aortic disease, and how we can balance potentially finding healthy ways to engage in sports and engage in activities. And so when we have a new diagnosis, we're not taking away big parts of a patient's life or big parts of a patient's identity. So I'm really privileged to get to work in a lot of multidisciplinary clinics where it's not just me, but also a geneticist, a genetic counselor, social workers, lots of other subspecialists like endocrinologists and pulmonologists. Having other subspecialists involved allows us to take really complex patients and make really complex decisions on an individualized basis.